Good morning to all of you who make this broadcast possible. Good morning to Gisela. And we take this opportunity to congratulate her for the award she received yesterday. Good morning to all our audience tuned in to this briefing. Today we have 277 patients admitted to our hospitals, 16 in vigilance, 185 are suspects, and 76 are confirmed active cases. In our primary healthcare system, our professionals and specialists are following up 219 people due to different clinical or epidemiological risks. Yesterday, the island's molecular biology laboratories processed again over 3,000 samples, 3,141 in the Pedro Curie Tropical Medicine Institute, 1,456 in Havana's Provincial Center, 444 in Villa Clara, 310 in Santiago de Cuba, 187 in the Brothers Almeidas Hospital Laboratory, 419 in the laboratory of the Civil Defense, 47, and in the Genetic Engineering and Biotechnology Center, 278. As a result of the study of these 3,141 samples, 10 people tested positive for SARS-CoV-2 and COVID-19. Thus, Cuba accumulates 198,675 samples studied, and 2,413 people have been diagnosed with SARS-CoV-2 and COVID-19. This represents 1.2%. Yesterday, as I always explain, samples were studied from all provinces of the country. The largest number came from Havana, which had 2,258, Matanzas 185, Cienfuegos 70 samples, Ciego de Ávila 77, Camagüey 60, Holguín 68, and so forth. Samples were studied from all provinces. The 10 cases confirmed yesterday, they are all Cuban. 9 are confirmed case contacts from the clusters we are working on, and 2,098, that is 88.5% of all cases in our country, have tested positive as confirmed case contacts. That is why it is so important that everybody who tests positive provides the largest number of contacts that they have had in the last 14 days. And likewise, if anybody knows that a person with whom he or she had relations recently have tested positive, that person should come forward and say it so that that person can be studied so as to prevent a possible spread of the disease. In one of the cases diagnosed yesterday, the source of infection could not be determined, and we now accumulate 110 patients during all the pandemic whose source of infection has not been identified. That's 4.6%. And with source of infection abroad, the same number remains unchanged, 163 people. Of the 10 cases confirmed yesterday, 8 are female cases and 2 are male. And now 49.5% of all cases in the pandemic is female, and 50.5% is male. And as you may notice, there isn't much of a difference in our pandemic. 7 of the cases were asymptomatic, and of all the cases confirmed in Cuba, 54.6% have been asymptomatic at the moment of testing positive to the disease. Of the confirmed cases in the last 15 days, this percentage is increased to 71.1%, and this is one of the main features of this disease, which highlights its high risk and beyond its transmissibility. And yesterday we were commenting some articles on COVID-19 airborne transmission through the droplets and the high transmissibility. And also we have to take into consideration the risk stemming from the number of people that are asymptomatic who spread the disease. 6 of the people diagnosed yesterday are from the 20 to 60 years of age. There is one 6-year-old female and one 19-year-old female. And in pediatric ages, there is a cumulative of 275 children confirmed in our country, out of whom 252, that is 91.6%, have been discharged, thanks to their favorable evolution and the therapeutic treatment they have received in our country. Of the 10 new cases, there are 2 patients from the over 60s age group. The 10 cases belong to the municipalities of Havana, from municipalities of Havana, and with these new cases, the province remains in first place in terms of positive rate, with the highest number of confirmed cases in the last 15 days, which now stands at 3.84, which is slightly higher than the one it had yesterday. Mayabeque province remains in second place with the same incidence rate, 2.08, and as I always reiterate, that the 13 remaining provinces and the Isle of Youth Special Municipality continue without confirming cases in the last 15, 30, or 60 days. With 2,413 patients diagnosed with the disease, until 12 o'clock last night, 76 remained active, admitted, 76 confirmed cases, 3.1% of all diagnosed people. 74 of them, that is 97.4%, are with a stable clinical condition, and this is a very favorable indicator in the evolution of our patients. And we always regret and convey our condolences for the death of 86 people who have died in our country due to the disease. Today is the 14th consecutive day without fatalities in Cuba, and that gives the island a fatality rate of 3.56%. And with this indicator, the island occupies the 21st place among the countries of the region of Americas and the 104th place in the world. We always mention the 2 people who were evacuated at the beginning of the pandemic, and 5 patients were discharged yesterday. 4 from Havana and 1 from Las Tunas province. And so far, 2,249 patients diagnosed in Cuba with COVID, that is 93.3%, have recovered and have been clinically and epidemiologically discharged. Today, this is not a favorable indicator. It's not positive, since we had more confirmed cases, 10 cases, than discharges, that we had 5. Until 12 o'clock last night, we had 2 patients who remained in serious condition that we had informed about over the last few days. They are in a stable critical condition, and we already And we already accumulate 14 days without COVID-19 patients reported in critical condition in our country. This is a demonstration of the preventive care and the preventive measures and the modalities, the preventive modalities used before the people acquire the disease, and above all with the main risk groups and the treatment protocols for COVID patients in our country. The world remains practically with no control of the disease. The same 185 countries remained diagnosing cases of COVID-19, and they report a total of 12,017,118 cases, with 215,313 people who were diagnosed with the disease yesterday in the world. Likewise, again, a very high number of fatalities yesterday. 5,374 people died in the world for a cumulative of 549,276 deaths, for a lethality of 4.57%. The region of the Americas remains the epicenter of the disease in the world, and it diagnosed yesterday 130,592 people with COVID-19, for a cumulative of 6,266,703 confirmed cases, and the region already accounts for 52% of all the cases reported in the world. Yesterday, 4,018 people died in the region due to COVID-19, for a cumulative of 276,520 deaths. This represents a 4.41% lethality for the region. In the world, the region of the Americas, the list of countries with the most confirmed cases, the United States ranks first with 3,055,004 confirmed cases and 132,309 deaths. Brazil with 1,713,160 confirmed cases and 67,964 deaths. Peru is in third place, Chile is in fourth place, and Mexico is in fifth place, but it has the highest lethality of the countries of the region, which is of 11.93% of all patients who have tested positive in Mexico. And this is the information we had on the behavior of the pandemic in Cuba and in the world.